So hello, my name is Dr. Richard Gerardo. I run the Dental and Cranio program for SOTO USA, and today I have here with me Dr. Steve Olmos, who is a dentist, TMJ specialist, and runs the TMJ therapy centers. Good afternoon, Dr. Olmos. Would you tell us about your program and how you approach TMJ and airway and how you look at the chiropractic part and how it complements your program?
Thank you. Absolutely. Patients come in seeking care for all sorts of aches and pains in their head and face, jaw joints, and very often, the head is the monitor of the whole body. So it's our job to triage and find out where origin of problems are coming from that then manifest themselves in the face and the jaw. Actually, the treatment that I provide is called craniofacial treatment. I treat craniofacial pain, and I also treat obstructive sleep apnea. So the name of our centers are the TMJ and Sleep Therapy Centers because of the direct correlation between airway and jaw joint problems. It's very difficult to separate those two things, and that, I think, is the common mistake that most practitioners have.
When you're teaching your residency programs and you're orienting the dentists to work with chiropractors, what is it that you emphasize with them from a professional standpoint, how you train them?
Well, it would be impossible for me to get efficacious result for patients seeking care from jaw joint and facial pain because very often a lot of the origin is coming from the cervical spine and or other structures. So in fact, we have a term for that. It's called cervicogenic pain. That's a headache that is originating from the cervical spine, an injury there. So their literature shows that there is very much, well, I should say that the interrelationship between the jaw and the neck in terms of injury, the comorbidity is significant, about 70%. That means every time there's a problem in the jaw, it affects the neck, and every time there's a neck problem, it affects the jaw. So in this way, it would be impossible to get efficacious result without having co-treatment with someone who is trained in the sacrooccipital technique as your organization is. We're very fortunate to have someone very capable in our community, and through all of the studies that I do and the research and the programs that I teach, it is a multidisciplinary approach. In other words, if we're going to make people better, we have to understand when we refer in order to make a timely referral and a proper referral so that we get consistent results. And without this special knowledge on how to do that, we would never have the success that we do. And I must say one other thing, that the specific therapy that your organization provides is unique and is not taught in all chiropractic schools. So therefore, many people who think they're getting equivalent care, they're not, and that's why the specialty training in these techniques is so valuable.
So a question comes to mind when I hear all this from you, so what is available for the dentists so that we have dentists that we can work with that understand our programs? So what is it that you have available to train these dentists to work with us?
Well, I have a number of different avenues. The last, I'd say 8 or 9 years, I've really focused my time on education. I am an adjunct professor at the University of Tennessee College of Dentistry, where I teach 3rd and 4th year students this process and my protocols. It's the first time that dentists are actually being taught a comprehensive approach to craniofacial pain and airway problems. It certainly was a deficiency in my education and every dentist that I've ever spoken to. One of the reasons why I'm at the school is because the school polled graduating students and asked them, what do you feel your education is deficient in? And they said 2 things. One was practice management, which of course every professional school would say, and the other was TMD or craniofacial pain. We just don't know what to do with it, and we didn't get any information. And it's about what it was for me 30 years ago. So that's my mission, to educate. We do that at the institutional level there, but I also have been doing it in a postgraduate way, and I teach courses through my research institute, and we do that in throughout North America, Canada, US, also in Australia. So we do this on a regular basis. So anyone who would want information about that could visit our website, www.tmjtherapy, T-H-E-R-A-P-Y, center, CENTRE.com. So that's how they could find more information.
Very good. I appreciate that. I want to thank you very much for your assistance and your support to our program, and we look forward to working with you again.
Super.